Dr. Weiss, I've seen myself without makeup. There's no way I'm going to go into shock.
Yeah, quiet, please. Please, Miss Kane.
Well,
no talking.
I don't want to be quiet. I want a mirror.
And now, you see, talking stresses the facial muscles, and I'd like you to be quite still, please, while I put on the fresh bandage, all right?
But I want to see my face before you put on the bandage. Did you hear me, Dr. Weiss?
Okay.
It's my face, and I demand to see a mirror right now. Why are my wishes being ignored?
Miss Kane, please.
I am the patient. Certainly I have rights.
Naturally.
Well, then why can't I see my face?
Miss Kane, I have redressed the cuts to your face. I've put on a clean bandage. Now, it's very important that the area remains sterile.
Well, I'll wear gloves then.
No. I'm not going to let you look into a mirror, make funny faces, opening up the wounds that are just starting to heal.
Wounds? I liked it better when they were called cuts. Wounds, that sounds very ominous.
Oh, I'm sorry. I didn't mean to frighten you.
I am healing.
Oh, yes. Yes, of course. You're healing exactly as I expected.
Dr. Weiss, is there something that you're not telling me?
What is it you'd like to know?
Well, I'd like to know when the bandages will come off.
Well, that depends on how fast you heal.
You're a plastic surgeon, right?
Yes, that's right. Yeah, Dr. Hayward asked me to come in to consult.
Why did he do that? Is there scarring? Because if that's the case, I mean, that's totally unacceptable.
Well, I'm sure that I will be coming in to perform a procedure sometime in the future.
Procedure? That's another one of those very ominous words. What are we did I need stitches? Do I need am I going to have surgery?
Well, that's yet to be determined.
Dr. Weiss, I'm sure that you're aware that I am the chair and the spokesmodel for Enchantment Cosmetics, and I have got to be back on camera to launch my new fragrance, and then I have to be picture perfect.
Miss Kane, as far as your professional schedule is concerned, let me be perfectly candid.
Dr. Weiss. You needed an ER.
Dr. Weiss and I are not yet finished.
Well, you are for now. Nurse, I believe that Miss Kane is strong enough with your help to take a few steps from her bed to the chair. Doctor?
Oh, excuse me.
Oh.
Would you know which room is Erica Kane's room?
Room 205 across the hall. But right now she is with the doctor.
Oh, dear, my driver's waiting downstairs.
Are you a friend of hers?
Oh, I'm a sister patient, actually. I outsmarted my doctor and recovered. No, all I wanted to do was drop this gift off to thank her for her kindness to me while I was ill.
Oh, I'd be happy to see that she gets it.
Oh, how very nice of you. Thank you. Thank you so much. Well, good evening, ladies.
All right.
We need to have a talk. I was under the impression that you were about to hit Miss Kane with the full extent of her facial injuries.
But you will have to be told the truth sooner or later.
That is my call to make, not yours.
Miss Kane is a very strong woman.
Let's not talk about this in front of the patient's room, shall we?
Oh, can we see... Excuse me, can we see Erica?
Sure, so long as you don't tire her out.
Yeah. Don, will you go ahead? I want a word with Joe. Sure. I'll be right with you. Joe.
How's Erica doing?
Well, I haven't seen her yet. Listen, darling, there's something I think you should know. Two men, who ought to know better, have been fighting over Erica.
You want me to have a word with Jack and Dimitri?
No, Dr. Hayward and Dr. Weiss.
Look at you! You're sitting up and everything.
Yes. Great God, Hayward gave me a permission slip.
Well, it's just wonderful to see you out of bed. Oh, here. Better give this to you before I forget.
Oh, Janet, you shouldn't have.
Actually, I didn't. It came from a friend.
Vanessa Bennett, that's very sweet. Oh, temptation. And I look so tempting at the moment. Well, let me try out the competition, huh? Oh, It's not bad.
Oh.
You want a spritz?
Oh, no, it's all right. I'll pass.
Oh, come on, married lady. Have a good time.
Well, Erica, you know, if I want to get Trevor really excited, I just dab a little bit of giblet gravy behind each ear.
Oh,
Are you all right?
please, I'm fine. I'm happy to laugh.
Well, I've been discharged from the hospital, but I would like to have this prescription filled with the hospital pharmacy, if that's possible.
Oh, I can take care of that for you.
You are a love. I'll be right here.
Miss Kane has asked to see her face. She wants to know her prognosis. I'm even being honest with my patients.
No one is asking you to lie.
You have implied that the damage to her face is minimal, nothing that a little dermabrasion or airbrushing can.
I am all for full disclosure, but in Erica's case, timing is everything. Her heart is still recovering from one major trauma. She needs time to rebuild her strength, regain stamina.
While we create false hope. When Erica Kane looks into the mirror, takes those bandages off, she's going to expect a miracle. A miracle it is not within my power to provide.
Oh, so you don't perform miracles, doctor? Well, guess what? I do. So while I walk on water, you can take orders from me.
Gentlemen, is there a problem? No, just in time. As chief of staff, would you mind telling this arrogant young pup to back off? Erica Kane is my patient, too. What has happened to her face is tragic, but I believe she deserves to be told the truth. Now.
Erica has taken a hit to the heart that nearly killed her. Yes, she is getting stronger, but one sudden shock could be life-threatening. Telling Erica Kane that she's lost her looks is like telling a singer that she's lost her voice, or a surgeon that he's lost his hands.
And it's my belief that a patient has a right to know their prognosis.
Obviously, I am not suggesting that we should withhold the truth forever. I'm just asking for some time for her heart to strengthen enough to withstand another trauma. Joe, I'm telling you, we drop this bomb on her right now, and we could flatline her chances of ever making a full and complete recovery.
People who undergo open heart surgery do need time to come back, John.
Look, you know this from your cardio rotation. Post-op heart patients are high risk for paranoia, depression, even temporary psychosis. Now, although I don't know Miss Kane very well, it's obvious that she's a passionate woman, ruled by her emotions. Now, we spill this news too soon, she could have an emotional meltdown, possibly try to take her own life. Now, I'm sorry, that's not a risk that I'm personally willing to take.
God help us, Joe. I'm afraid he's right.
I just can't shake this feeling that Dr. Weiss is holding something back from me.
Well, you know, doctors can act like power-driven egomaniacs sometimes. It's as if Arrogance 101 is a required course in med school.
Well, I'm sure David Hayward aced that course, but Dr. Weiss is actually sort of charming.
I've got an idea. I brought a deck of cards. You want to play gin rummy?
Janet, the only thing I really want is a mirror. Can you have one in your purse?
Why?
Because I want to take a really good look at the bandage on my face.
Oh, gee, I thought I had one in here. I don't seem to be able to find it. I guess I forgot it when I changed purses. Sorry.
Janet, help me up.
You want to get back into bed?
No, I want to walk over there to the closet. Because I remember from the last time I was here. I remember there's a mirror right there, right in the back of the door. Will you open it for me?
Okay.
I knew it was there. I mean, I could feel it, but this bandage covers half my face. Why would Dr. Weiss put such a big bandage on my face if I just have a little cut?
We tell Miss Kane the truth, or not?
I'm going to side with David on this one.
Thank you, Joe.
John, I see your point of view. Believe me, I do. But speaking as one who's gone through open heart surgery myself, I can tell you that the recovery process is not any day at the beach.
You came through it just fine.
Well, yes, I suppose. I mean, it's true I didn't experience any post-op psychosis or have a nervous breakdown, although I think I came close to giving my family one. To say I was hell to live with would be a gross understatement.
Joe, it didn't hurt that you were going back to a profession.
That's right. Randall's very right. You see, Erica has lived most of her adult life in the spotlight. I mean, she is the image she projects to the public. Now, if she is to go on with that spotlight turned off.
She'd be like a child in the dark.
In any case, she's going to be devastated. Beyond that, we can't predict anything. The only thing we can do is make sure that her physical recovery is not mitigated against. We all agree on that?
Absolutely.
All right, gentlemen. But when you do break the news to her, I want to be there to answer her questions truthfully and honestly.
Thanks for backing me up, Joe.
I didn't do it for you.
Bravo, my son. What a performance. Smooth as a snake's underbelly.
You know how hospitals are. I mean, they want to jack up the bill to the patient so they can turn around and bilk the insurance company. So what happens? It's $2 a pop for an aspirin, and they start charging $1 an inch for gauze.
Dr. Weiss says he wants to perform a procedure. I wonder what that means.
Procedure? That could mean anything. They could apply a cold compress and call it a procedure.
Dr. Weiss is a plastic surgeon. He wouldn't deal with just little cuts and bruises.
Listen to me. I'm the queen of reconstructive surgery. I got a whole new face. Not a scar to show for it. Whatever it is that they're gonna do to you, I'm sure it's gonna be a very simple thing.
What's that slogan? Oh, yes, careful. The life you save may be your own.
What are you raving about, Mother?
Well, that little scene you just played. I mean, all care and concern about poor Erica. When, in actuality, it's all about preserving your own precious hide. Well, you were responsible for the accident that disfigured Erica Kane.
You were discharged from this hospital. Don't you have a slow boat or a nuclear missile that you need to be on?
Ooh, and leave Pine Valley? Just when I'm beginning to feel like sort of like at home here. Don't perish the thought, do you know? I think I'm here for the duration. Besides, my new friend Erica is going to need a very solid shoulder to cry on.
You stay the hell away from Erica Kane.
And if I refuse?
Don't push me, Mother.
One little peek won't hurt.